course she does.
The slot and clipboard has a room number on it.
This is way more organized than it would be in reality.
Pain to the touch? I thought it was harsh.
No, his belly hurts and he has pain to palpation. But you're right, if it's a heart attack, it does not hurt when you touch.
Possibly might be over 450. Possibly.
He's not going to fit in the CT scanner.
Can she have ice cream?
She can have anything she wants.
There's no diet limitation to anyone on hospice.
You're looking at the wrong eye. We start with a good eye for comparison.
They're not explaining anything to the patient. Keep asking questions because they're not saying what they're doing.
This is a communication device.
That's fancy. We just have a big poster board they can point at.
Start with my pinky slowly over a few minutes.
Is that the normal way to do it?
I've never done it this way. Usually we use a bronch to awake into being.
And ordered an unnecessary brain and abdominal CT. Good thing you did.
Good thing her attending told her not to order it. Also, like, that patient was there for 3 hours for something so simple, just because they didn't have an interpreter.
Could be bipolar or schizophrenia.
It would have been cooler if this guy would have been a female and they ended up having NMDA and encephalitis. It would have been so much more interesting.
This tube and pass it through your nose.
There you go, that's the bronch. Yeah, see, that's not how I would do it at all. Put the tube over the bronch, put the bronch in to make sure you're going where you need to, and then you push the tube over it.
I'm glad you were here today. Me too.
I'm tearing up.
Blockbusting medication. So, get it.
It's not that simple.
You just take blindness in your eye.
The alternative is that you bleed into your brain and then you have severe disability and die.
Inhales, we should see cords.
That's complete plastic, but whatever. I can tell that they're doing it on a plastic dummy.
It's real enough for me.
It's very simplistic. It doesn't quite look like that, but it's close enough.
And the tube slides in.
Okay, so they did it slightly different how I would have done it, but it's essentially the same.
This is a numbing shot for the tip.
They should have done Lido with Epi at the same time. It would have stopped the bleeding and numbed her at the same time. I can't imagine getting lidocaine in your tongue though. That would hurt so bad.
Really?
Numbing itself hurts. Imagine it in your tongue. It's like a bee sting in your tongue. Yikes.
Wow, that is some rash.
Dr. Lindsay, we have a case.
They're so excited.
It's just gonna be something simple.
Phytophotodermatitis. Taking 3 gallons of margaritas for a party.
That doesn't track at all because phytophotodermatitis would not be all over his legs, all over his face. He would have had to like bathe in it.
On top of the endless cotton, she could stop breathing.
And
Even if the negative side effect is death.
yes, you give as much pain meds as she needs, knowing that the risk is that she will stop breathing. You're not giving the pain medicine so she stops breathing, you're giving it for pain, knowing that she could stop breathing from it.